As a personal trainer, I spend most of my time telling people how to get fit and healthy, how to bulletproof their bodies, and most importantly, how to not get injured, which is ironic really because in November 2024, this happened. My name's Isaac, and in November 2024, I was found to be on the receiving end of a dangerous tackle whilst playing a game of rugby, which in total would have left me sidelined for 2.5 years. So as any normal person does, I've taken up vlogging. Here's my attempt at documenting the rehab process. So prior to my injury in November 2024, I was just a lanky wannabe rugby player with no skill of any kind, who definitely didn't have what it takes to make it to those higher professional levels. I loved the pub, drinking with my mates, and just, yeah, life was pretty stagnant. So at some point within the last 14 months since my injury, and definitely for the first time ever, my health, with specific regards to longevity and maintenance, has become an absolute priority of mine. Fully recovering from my injury is not just an option. It's the difference between coming back fitter and healthier than ever before, or watching myself slowly decline, and having to live in pain, which I've seen many people do previously. One of the things that I'm going to come back to over these coming videos, over this video, is actually not just recovering from my ACL rupture, but just coming back better and bigger than ever. And since then, a couple of the things that I've worked on, not just physically, but bettering myself educationally, getting that CV much more appealing to prospective employers, is that actually I've become a personal trainer. I've started training clients and started passing on my knowledge and experiences to others. I've got myself a sports massage qualification, and all of this is in aid of my masters, which I'm currently undertaking, 2-year masters, and I'm now in my final year of becoming a chiropractor. And I guess the point of these videos is to give me an opportunity to talk about the next steps, what happens after my surgery. People who are close to me, people I know I've spoken to, and I'm probably never going to play rugby ever again. As I transition away from a 15-year playing career on the rugby pitch and towards my next adventures, having a purpose, having something to work towards, having something to work on is going to be really, really important to me. Hence this very, very cringy video of me talking about myself. So to me, the goal is simple. It's to prehab in preparation for my surgery. It's to have my surgery. It's to rehab after my surgery, with the ultimate goal of coming back better, coming back fitter, coming back stronger than ever before.
What we've got here is a screenshot taken from my medical records, which is just outlining my injury diagnosis, taking this all down to an ACL tear with tears in both of my cartilage, so my meniscus, along with 2 further ligaments having received significant damage. Moving on, here is a plan of action based on my injury diagnosis. As you can see, I'm going to have an ACL reconstruction using a graft from my hamstring, along with repairs to both my medial and lateral meniscus. And then, if deemed necessary, I'm going to have construction of a new ligament, a new anterior lateral ligament in my leg, just to reinforce all the work that's been done and reduce chances of further injury.
So I'm really, really excited about the next stages of my rehab. I'm looking forward to taking those first steps after my surgery towards becoming fit and healthy again, being able to partake in physical activity, sports, running, without worrying about whether I'm going to make my knee worse, whether I'm going to damage it further, and just generally being more pain-free throughout general everyday activities. The next 12 months are going to prove to be a great learning opportunity for me. It's going to give me lots of knowledge and experiences that hopefully I can pass on to others. I feel really, really ready for this operation and the steps following it. I'm curious to see how this sort of next 12 months affects me both physically and mentally. Psychologically speaking, you know, I may need to sort of take steps to really sort of improve confidence back in my knee. I'm fully expecting, you know, once this operation is done and I've kind of been given the all clear to start running, start moving a little bit quicker, a little bit more sort of fear through my knee, that actually I'll be sort of nervous and apprehensive in the beginning, but hopefully with some training and some sort of conversations that actually this issue will be resolved and sort of behind me in no time. I'm also hoping to capture and create some fun and interesting content for all those people interested in my journey. I'm looking forward to these next steps, and I hope you are too.